So good afternoon everyone. Today I am going to talk about thalassemic retinopathy. So beta thalassemia is a disease per se which can affect almost all the systems of our body. The ocular manifestation can be rare but cannot be ruled out. So ocular findings are varied and can range from ocular surface disease till the retina. The retinal changes also depend upon the varied factors, among which the severity of the anemia is one of the key factors which determines the severity, which determines the disease course. So today I am going to discuss one such case in which the severity of the disease determined the course of the disease. A 17-year-old female presented to our OPD with a chief complaint of diminution in vision in both the eyes since 1 year. She had a past episode of weakness and anorexia for which she was admitted. Her hemoglobin level dropped down to 2 milligram per deciliter, for which she received a packed RBC transfusion. And through thorough investigation, a diagnosis of sickle beta thalassemia with vitamin B12 deficiency was established. Currently, her best corrected visual acuity in both the eyes was 2/60, and anterior segment findings were within normal limit. On posterior segment evaluation, we could find multi-layered hemorrhages with the heme and serous collection. So with the clinical picture, we had a diagnosis of anemic retinopathy in our mind. So we decided to do OCT and FFA for the patient. The OCT showed multi-layered hemorrhages, and the FFA thankfully didn't show any peripheral neovascularization. So at this point of time, we had two treatment options with us, to either to plan for a vitrectomy or to go for a systemic control. We decided to go for systemic control and wait for heme to resolve. We continued our systemic therapy of tablet folic acid 5 milligram daily and capsule hydroxyurea 500 milligram twice a week. We followed up our patient on 2 weeks interval, and hemorrhages were resolving at each follow-up visit. This is the fundus photo image at 2 months follow-up. The visual acuity at this point of time was 6/36 and hemoglobin levels were 9.5 milligram per deciliter. So my case is unique in the severity of the retinal finding associated with the anemia and associated B12 deficiency, and also such an alarming visual loss was restored just by improving the systemic condition of the patient. We could clinically imply from this case that sometimes two seemingly different appearing condition can be a different spectrum of a single clinical condition, and also a nutritional deficiency can also cause a devastating complication. A multidisciplinary approach is very much essential to deal with such cases. So we can take home a message that sometimes no active intervention can also be a mainstay of treatment and can show miraculous response. Thank you, sir.
What are the platelet levels?
Sir, platelet level are normal.
P. Vidya, I think your photographs were excellent. It's in cover photographs. And why didn't you go for a surgery once the hemoglobin was cleared? Because lastly, what we saw, a lot of fibrosis has occurred.
No, we never intervened the patient.
So if you could have intervened after the hemoglobin would have corrected,
Yeah,
then you would have given some kind of vision to the patient.
Yeah, actually the patient was a 17-year-old. So actually the induction of PVD is quite difficult in this patient.
That's not a reason to not to take up surgery.
So we had two clinical options, but since the patient was improving with the systemic control, so we decided to wait furthermore if the patient could improve more. And then
if you have to take a surgical intervention, what will be the right time in this patient to go ahead with the surgical intervention?
Once there is clear, we can see the media clearly. Once the media clears out and the hemorrhage is set.
What is the time period you will try to intervene? 1 महीना, 2 महीना, 6 हफ्ते?
6 months.
6 months is too long a period. I mean, when you will like to intervene in this?
You can make it weeks instead of months.
3 weeks.
Your 3 to 4 weeks. Thank you.